Hello, my name is Michelle Espinosa, and today we'll be talking about wound healing. What is a wound? A wound is an injury to the body and may be caused from violence, accident, or surgery. It typically involves laceration or breaking of a membrane such as the skin, and usually damage to underlying tissues. There are three stages of the wound healing process. It includes inflammation phase, the proliferative phase, and the remodeling phase. The inflammatory phase begins at the time of injury and lasts up to 4 days. It includes clotting of platelets and constriction of blood vessels to stop blood loss, in addition to the arrival of white blood cells to kill bacteria and naturally clean the wound site. The proliferative phase begins about 3 days after injury and overlaps with the inflammatory phase. It involves cells called fibroblasts to help produce new collagen, create new blood vessels, and repair the vascular epithelial tissue. The remodeling phase can continue for 6 months to 1 year after injury. Collagen continues to increase and the tissue begins to contract with the help of fibroblasts, both of which add strength to the new tissue. Excessive collagen can cause scar tissue formation. I found a fun fact about wound healing. The first people to apply honey to wounds were Egyptians.